Okay, so I'd like to call the order the November 18, 2021 meeting of the Emergency Medical Care Advisory Board. It's scheduled to start this afternoon at 4 o'clock. It's 4 o'clock, so let's go ahead and kick off. So we'll forego the flag salute because we are all meeting remotely, but thank you for having that on the agenda. Mr. Ferris, could you please call the roll?
Thank you, Mr. Chris Miller.
Here.
Leslie Wilmer.
Here.
Bruce Peters.
Here.
Sheriff Youngblood.
Here.
Kathy Prout. John Surface.
Present.
Dr. Lyon.
Here.
And Chairman Maggard. We have
Here.
a quorum, sir.
Thank you very much, Mr. Ferris.
This is Orchel Cryer. I'm here too.
Thank you,
Oh,
Orchel.
thank you, Orchel.
Yeah,
Okay,
and Dr.
so-
Canton, I just joined.
Very good. Good afternoon, Doctor. Okay, so we have a pretty straightforward agenda this afternoon. Let's start with our consent items. They are all listed under, let's see, there's the approval of minutes number 5, and under item 10, all the items A through E are on consent. Mr. First, I believe that's all the consent items, isn't it?
That's correct, sir.
Okay, so does any member of the public or any member of the board wish to make comment about any of those items on consent? I don't hear anyone or see anyone, so I would entertain, if board members don't have any questions, is there a motion to approve our consent calendar?
Motion.
Second.
And a second. Did you guys, the secretary, establish who those were?
Yes.
Okay, very good. Okay, then can you call the roll for the affirmative or opposition votes?
Yes, sir. So for the consent agenda, do you want a full roster? That would be Chris Miller.
Yes, let's do it that way. Then we have them all recorded.
Okay. Leslie Wilmer.
Yes.
Bruce Peters.
Yes.
Sheriff Youngblood.
Yes.
John Surface.
Yes.
Dr. Lyon.
Yes.
Chairman Maggard.
Yes.
Orchel Cryer.
Yes.
Dr. Canton.
Yes.
All ayes, sir.
Very good. Thank you very much. The next item is would typically be our subcommittee report on our ambulance patient offload times, the APOT task force. But as you may recall from our last meeting, the meeting of that task force has been suspended during these COVID times because it's just, nothing near normal. So we are foregoing that. Is there anything you need to say about that for us, Mr. Ferris, before we proceed, or any board members have any questions or comments about that and us not having a report?
Nothing to add, Mr. Chairman.
Thank you. Anybody else have any comment? Okay, since there's no report, there's no reason to take a vote or a receive and file because there's no report. Are there any members of the public present today that would like to make comment to us about anything that is not otherwise on our agenda? Mr. Ferris, are you aware of any other members of the public that might be in attendance that are online with us that we don't know about, or I don't know about?
I'm not aware of any, sir.
Okay, we'll give just another moment if there's somebody in the public. Is that somebody trying to comment? Don't think so. Okay. All right. So we'll. My understanding, there is no public comment. There are no public requests. We do not have any unfinished business. We've dealt with our new business items under consent. So now we have item number 11, our manager's report. Mr. Ferris.
Thank you, Mr. Chairman. Thank you, everybody, for being here today. I apologize. We did have to reschedule because I overlooked the holiday last week when I scheduled all this last year. So I appreciate all of your time here today. So as I imagine, EMS has been extremely busy since we met last. One of the positive things that's come out of the last several months is that EMS is in the process of expanding. We've added a new senior coordinator position as well as a new coordinator position. This expansion includes separating EMS operations and emergency preparedness within EMS program. Addis has been promoted to the new senior position and will supervise emergency preparedness program. This will include oversight of the HPP, FEP, and PAN-FLU grants, Kern Medical Reserve Corps, Kern County Healthcare Coalition, supply acquisition through the Salesforce system, warehousing and distribution of supplies, net monitoring, and regional disaster medical health specialist oversight. George Bailey retains his senior EMS coordinator position and will supervise EMS operations, which includes oversight of the daily EMS system, EPCR data collection, certification and accreditation, quality improvement, protocol update, training, designations, and response time compliance. We have a new employee starting on November 29th to backfill Andy's vacant coordinator position, and we are currently interviewing to fill the additional new coordinator position at this time. Hand-heavy training has completed, and we are now implemented system-wide. EMS is currently building a reporting mechanism that will cross-reference the use of the hand-heavy device or system in order to monitor the use of hand-heavy and then compare that to the proper administration of medications for pediatric patients. So we're very excited about this move forward, being able to assure that our pediatric patients are getting the proper dosage of medications. The warehouse is complete. All supplies and equipment have been moved into the warehouse. We have implemented a cloud-based inventory and asset management system, which is now fully operational. This gives ample room to store all supplies and equipment that might be needed for various emergencies/disasters throughout the county. We have large numbers of all types of PPE supplies and equipment necessary to set up a medical shelter or ACS if necessary, surge and decon tents, supplies needed for public safety power shutoff issues, and multi-casualty incident equipment. EMS has continued to work diligently with our hospital to maintain staffing levels during this last COVID-19 surge. We have worked closely with the state, and we were able to secure 3 National Guard medical teams along with a state AT team and multiple ambulance strike teams to provide staffing within our hospitals. Additionally, we were able to secure a team for Kern Medical that increased our bed count in Kern County by 6 intensive care beds and 20 med surge beds. We're currently in communication with the state regarding the possibility of a second expansion hospital in Kern. That has not been set yet, but we're talking about it with the state. Has completed the process for securing a contract with for the exclusive operation of ambulances in the East Kern. On August 24th, the Kern County Board of Supervisors approved the contract with Hall Ambulance Service to provide ambulance coverage in EOA 11. This contract has a minimum term of 5 years and the possible extension of 5 on approval of both parties. On September 14th, EMS received a letter from Aaron Moses, the owner of Delano Ambulance Service, requesting approval for the sale of his company and the transfer of the exclusive operating area rights for EOA 3 to Hall Ambulance Service. The request was processed. September 28th, the Board of Supervisors approved the sale and transfer of the exclusive operating area rights to Hall Ambulance Service. EMS continues to work with our providers to improve our response time compliance. While we still remain in surge from the pandemic, we are aware that we need to make lasting changes to our system for the future. This issue is not isolated to Kern. We are seeing similar situations throughout the state and across the country. Because of this, we realize that we must make changes now, and therefore we are working to develop alternative response configurations, staffing models, and transport modalities with the goal continuing to ensure the appropriate level of service is provided to those that are truly in need of medical care. Level 2 of the surge plan has allowed us to respond to third-party non-transport first responder agency to calls to perform an assessment and determine the patient's true condition. This has worked well to help reduce ambulance responses and transports. We are looking at ways to continue this practice following the surge. At this time, we're also looking into a new system called Tele 911 that would allow EMTs and paramedics to bring the physician to the patient while on scene via the internet, thus reducing the need for many transports today. We've been conducting drills. Most recently, yesterday, EMS staff, along with Kern Medical and Bakersfield Fire, participated in a full-scale drill to test communications countywide during a disaster, as well as an organophosphate release and a Chempack distribution exercise. The Kern County EMS EP program tested all hospitals, skilled nursing facilities, and alternate healthcare facilities in the use of KHAN and the ReadyNet communication systems. This morning, EMS program staff assisted Kern County Department of Airports with the FAA and TSA mandated tri-annual full-scale exercise at Meadows. This event involved more than 50 simulated patients utilizing Bakersfield College students, as well as participation from Hall Ambulance Service, Kern County Fire, Kern County Sheriff, and Airport Police. The EMS program staff served as exercise evaluators and members of the incident command structure on site. Image trend continues to prove beneficial to the EMS program. We are working on adding a training tab to our image trend portal that will allow for CE training and automatic tracking of CEs for all paramedics, EMTs, MICNs, and dispatchers in our system. Our certifications portal continues to work seamlessly, and over the past 3 months, we have certified 163 people through the system. That concludes the majority of this part of my report. Before I move on to the COVID update, I did want to address real briefly with you all the membership of MCAB. The document in your packet includes the membership roster, and I just wanted to, I'm reaching out and asking for assistance from anybody who can help us. We need to fill up some of these empty spots we have on MCAB. Right now, we need Police Chiefs Association to fill the alternate position for the air. We need 2 positions for the Fire Chiefs Association, both the member and alternate. We need an urban consumer alternate. We need a rural consumer alternate. We need a Kern mayors and city managers member. Kern County Hospital Association, we're going to, in the very near future, need 2 positions. And we now need a Kern Association alternate since Delano Ambulance sold, and Aaron Moses has stepped down from his position. So if any of you can reach out, Sheriff, if you can reach out to the Police Chiefs Association, if anybody can assist in getting some nominees to the Board of Supervisors, that's how this works. This is a subcommittee of the board, so we need to get nominees so that they can vote on them and get them in place so that we can fill our membership. Okay, so with that said, I'll give you a real brief rundown of the COVID situation in Kern County. There we go. So we are still in surge plan. We're on level 2 of our surge. Since we last met, we've had a call volume of 33,740 ambulance calls, and that's an average of about 366.73 a day. We've had 1,358 alpha calls. That means an ambulance does not respond. And we've had 534 pro safety responses. That is that third party first response agency that is responding to assess these patients and determine their true condition. And we've had 251 occasions of an ambulance that has responded to a surge call due to either a re-EMD by dispatch, pro safety requested an ambulance, or fire requested an ambulance. Our case numbers, we are starting to see them drop a little bit. Finally, it's taken quite a while in the Central Valley to see numbers start to drop. So we are seeing that. We are just over halfway through November, and we're at 52, 59 in our daily case count. So it'll be interesting to see if we match October or not. Ambulance decon volume, we can see that that is starting to drop off too a little bit. As again, we're halfway through November, so hopefully we can end up a little less than we did in October. Currently, our matrix, our case rate is 20.2. Our testing positivity is 5.8. Lowest quartile testing positivity is 6.5. Our testing rate is 413.7. The state shows a regional ICU capacity at 11.3%, and they show Kern County at 12.4%. Now, we have a dashboard that the hospitals report to directly to us, and as of yesterday, they were showing still had 11 ICU patients that were in surge. That means that they're outside of the normal ICU place in the hospital. Currently, our facilities are showing 196 hospitalized confirmed COVID and 45 COVID confirmed ICU patients. These numbers are finally starting to come down a little bit, so that's a good sign. We have seen some movement in the prison system. We have approximately 6,855 total inmates infected, and that's up 92 from. Basically, this is a week-to-week chart. So from a week ago, it's up 92, and then 3,697 staff, and that's up 42 from the week ago. Looking at our vaccine distribution, this is in our registry are 902,037 administered to Kern County residents, 52,713 first. We have 416,225 fully vaccinated, and 37,375 of those were J&J vaccines, and that totals 45.2% of the total population and 55.2% of the 12 and up population. And we now have added our 5 and up population, and that's 48% of that. 65 and older population, 187,347 administered, 79,483 fully vaccinated, and 74.7% of the population. 5 to 17-year-olds, we have 82,992 administered, 1,973 fully vaccinated, and 43.2% of 12 17-year-olds, 19.9% of 5 to 17-year-olds, and of all those, we have 5,909 that have had their first dose. 5 to 11-year-old population, since implemented, Kern has seen 3,011 administered doses. Booster doses, 25.4 million nationwide, so that's 14% of the fully vaccinated population over 18. State projections right now are at 25 million. 73.6% of the eligible population is fully vaccinated, and nationwide over 194 million fully vaccinated. That's 58.5% of the total population, and 68.4% of eligible population. That's 12 and up. Looking at Kern County Public Health dashboard, during our weekly COVID-19 updates, I show this dashboard every week. We've talked about this last surge and how it has extended itself, actually increasing a little bit, not looking anything like the previous surges. So far, as of this was pulled on the 16th, we had 154,583 confirmed resident cases and 1,734 deaths. Looking at state modeling, state shows we have possibly another surge coming. This is, they're labeling this waning immunity outweighing booster shots. And so what we're looking at here is the possibility of another surge. This was much higher a week ago. It has come down since then. So we're hoping that the more people that realize they need their vaccine and their booster shot, this line will continue to drop. But we are looking possibly at another surge, and looking at hospitalizations, we see that shortly after Christmas, 1st of next year, we're going to see a swing upward, and the hospitalizations could surpass what we had in this last surge. So we are hoping that the state is wrong. However, we have been right on their line the whole time here. So looking at the 30-day projection from the state for hospitalizations, it is trending down. They are stating by December 17th, we should be down to around 66 hospitalized COVID confirmed patients. Let's hope that that holds true. And then our daily ICUs, they're stating in 30 days, we should be down to 16 ICU patients. So we're going to hope that that remains true. That concludes my report, sir. I am available for any questions anybody may have.
Thank you, colleagues on the board. Do you guys have any questions for Mr. Ferris about that report? Are there any members of the public that have any questions about the report? Mr. Ferris, I have just one area of concern, and that is, how confident are you that we are equipped and have taken the steps necessary to deal with the surge that may happen in late January, early February, and thereafter?
I'm pretty confident that we're prepared. That is why we are continuing to reach out to the state to try and add more beds to our county every chance we get. And I think that if we can get a little bit of a break like that projection shows, I think we will be able to handle it.
Well, it'd be nice when spring comes and we're through that, won't it? Okay, thank you. Is there, I didn't hear anybody had any questions or comments, so in the absence of that, is there a motion by one of the board members to receive and file the manager's report?
Motion, Bruce.
Thank you, Bruce. Is there a second?
Second.
Thank you, Dr. Lyon. Mr. Ferris, can you take the roll call vote?
Yes, Mr. Chairman. Chris Miller,
Yes.
Leslie Wilmer,
Yes.
Bruce Peters is a yes. Sheriff Youngblood.
I'm a yes, and I have to run.
Okay.
Hi, Sheriff. Thank you.
Vice Sheriff, thank you. Kathy Prout,
Yes.
thank you. John Surface. Dr. Lyon.
Yes.
Chairman Maggard.
Yes.
Orchel Crier.
Yes.
Dr.
I think that was me. Yes.
Okay. We have all ayes with the exception. I did not hear response from John Surface.
Okay. We still have sufficient for a quorum without that vote and without the sheriff. Wait a minute. Without his vote alone.
Yes.
Okay. Thank you. Next on our agenda is there are no miscellaneous documents for receipt today. So next is item number 13, board member announcements or reports. I may have more to say in a second, but I wanted to start by commending and thanking Bruce Peters for his many years of service to our board. Mr. Peters is deservedly decided, I don't want to misspeak for you, Bruce, but I think you're just retiring and you're going to go enjoy the good life, and good for you. But thank you for the many, many years of service you've given our community and the great care you provided. So we want to commend and thank you and wish you the best in your retirement.
Thank you, Mr. Chairman. I appreciate that. It's been an honor and a privilege to be associated with this group. to work with this leadership. I want to especially thank Bryn and Jeff and the team. He reports on all the things COVID over the last year and a half. We would not have been able to get through it without the support of the EMS, support of the county public health department, the Mohawk, et cetera. And we are all grateful as a hospital group to that support. And me personally, I'm very grateful for the relationship that I've had with everybody here. And I thank you very much for allowing me to be part of this. Thank you.
Thank you, Bruce. We wish you the best, and thank you again for all you've done for us and for our community. Do any other members of the board wish to make an announcement or make a report?
I have maybe a comment. Here's Orchel, see it, Taff. I just recently had COVID. I was in a hospital for 35 days. And I just want to thank the Kern County Fire Department and TAF. I'd like to thank Hall Ambulance for professionalism and a job well done. I was moved about twice, and they did an excellent job in their service. TAF Westside Healthcare treated me first, and then I went over to Mercy Hospital. The doctors there were terrific. I wasn't the best patient, I'll admit that. I don't like hospitals. After 35 days, it just drives me crazy. But they saved my life. Basically, they saved my life for the doctors they had there. They could improve on the food a little bit, but they did an excellent job.
Hey now.
From there, I went over.
Well, Orchel, go ahead.
And then I went over to the Bakersfield Rehab Center, and I was there till November 5th, and they were terrific. I can't say enough of the nurses they have there. And I was in the red zone for 14 days. They moved me over to the yellow zone, and each zone is a little different, but I had to appreciate what they had to go through because different types of patients they had there, and they did a remarkable job. And I can't say enough for the medical, the fire department, and the ambulance. They're just fantastic. I've been out now since I got out. I think I got escaped from prison, or not prison. It was very confining. You can't do much, but they did a wonderful job. I'm alive. I have some issues. I'm on oxygen still. I don't know how long I'll be on there because it attacked my lungs pretty severely. But I'm happy with the job they did. I just want to give a shout out to the people that helped me out. That's what I want to say.
Well, Orchel, we are grateful that you have made it through and are recovering, and thank the good Lord it wasn't any worse for you.
All right, thank you.
Would anybody else like to make any comments or announcements this afternoon?
Yes.
Mr. Chairman. Sorry.
GK, let's let, I think that was that Kathy?
Yes, sir.
Then we'll come back to GK.
I'm sitting here with our city manager, and we have some concerns, and we've scheduled some meetings and thought maybe it would be good for you to know in regards to ambulance service out here in our area. So I'm going to let Gabriel go ahead.
Gabriel, why don't you identify yourself since we're on
Gabriel Gonzalez, City Manager for Chapter. Thank you, Mayor. We just wanted to bring, we've been informed by some of our residents, a handful of them, that they're experiencing some delays when they called for ambulance service. It took an excess of like 30 minutes in one case, 45 minutes to an hour on another. And so we do have a meeting set up with Hall Ambulance to address those concerns, and also with the CAO's office and public health in the coming weeks. But in talking with our mayor, we wanted to bring this to the attention of the committee because our residents are seeing some significant delays with ambulance service responding into Shafter. Apparently these ambulances are coming from outside the area because of the deployment, and our ambulance here in our city gets called out to another area, and the ambulance coming in to backfill is taking what they, in their minds, would be lengthy response times.
Okay. Are you guys comfortable meeting with Hall yourselves at this point, or do you want Jeff Ferris to be involved in that as well?
I think at this point, we're comfortable. I can follow up with Jeff and keep him informed of what those discussions were. But I think at this time, we feel comfortable, the mayor and I meeting with them.
Thank you, Mr. Gonzalez, for that, and thank you, Kathy, for bringing that to our attention.
Yes, thank you.
GK had something, but somebody raised their hand. Was that related to what Mr. Gonzalez was just saying? I can't see, Mr. Ferris, who raised their hand.
It looks like Mr. Osorio, I'm sorry, Mayor of Delano.
Mayor, let's. I didn't. Are you speaking about the same issue?
Yes.
Oh, I'm sorry. Then you go right ahead. GK, we'll get to you in a minute.
Yeah, I apologize about that. I missed the public comment portion, but I did want to echo some of the same concerns about response time about Hall ambulance here in the city of Delano. Our city staff has received a number of calls, also from Kern County Fire, about the delay from 20 minutes to a couple hours. And so I just want to communicate that to this board. I think I heard during the report some of the reasons behind why that is. But again, I just wanted to raise our concerns from our city council and from city staff and from a few of our community residents here tonight. So thank you.
So Mayor, will you be joining with Shafter in the same conversations, or will you have your own separate conversations?
We've started having some conversations, but I think we can follow up with Shafter and see if we want to do those joint conversations or independent ones.
Okay. And can you guys then keep Jeff Ferris in the loop so we're up to speed on making sure you guys are taken care of?
Thank you.
Okay, thank you, Mayor. GK, I'm sorry I put you off twice there.
No, that's fine, Mr. Chairman. I had a procedural matter I wanted to bring to the board's attention as it looks at its coming meeting schedule. And that is that the governor's executive order N29-20 has been suspended, and a new section of the government code AB 361, which is section 54953 to the government code, provides a local agency with teleconferencing meeting options as long as certain findings are deemed to exist. And so I'm going to be recommending to staff that a special meeting be held approximately 2 weeks from today. I think that's December 2nd, to pass a resolution to cover this meeting that indicates that remote meeting was deemed necessary in this case. And then because this board does not meet every 30 days or less, when your February meeting arises, you'll have a similar resolution to pass at the beginning of that meeting if it's deemed that remote meeting is also recommended, which I believe it will be. So I just wanted to give the chairman and the rest of the board members notification that I'll be recommending to staff there'll be a special meeting to pass a resolution that will cover this meeting. And then in February, you'll do a similar process to sustain the remote meeting process.
So thank you, GK. So is it not on our agenda today? Is that way we didn't have it teed up
That's
to vote
correct.
for today?
That it's not. It was not. That was my oversight, Mr. Chairman, and it was not on your agenda today. So that's why I'm recommending that a special meeting be held on December 2nd.
It's no small effort to get all these folks together with their busy schedules. Is there any way we can make an emergency finding that would allow us to add it to the agenda at the last moment and make a vote today?
Mr. Chairman, we can make that a matter of record. I understand that. And I think that I do not have the resolution in the body of your agenda. I understand the point that you're making. But I think that given what we've heard from Mr. Ferris, I would recommend that a voice vote be taken today to cover this resolution that and the findings be adopted that a remote meeting was necessary for today, that be incorporated and memorialized in your minutes. And then we will go forward in February with the resolution, which will be necessary again because you don't meet every 30 days or less. So I understand your point, Mr. Chairman. I also understand kind of what we've heard from Mr. Ferris and the seriousness and the surge elements of what's happening in Kern County. So I would concur that if we have a voice vote today based on my recommendation that you adopt the findings that an emergency does exist, a health emergency continues to exist in Kern County, and that for purposes of today's meeting, a remote meeting was necessary. I think that will be sufficient.
Okay, so it's a little bit complicated, the wording. So GK, could you state the wording of the resolution? And then if somebody is comfortable with that after you've heard him say it, then one of us can make a motion to adopt that resolution and then a second, and then we can vote on it. So GK, could you state it for us one more time?
Yes. The findings would be that under section 5.4 and 9.5.3 of the government code, that this board is recommending that a remote meeting be held today, given that the health emergency still exists and that measures to promote social distancing and the health of its constituent members is preserved through that remote meeting status.
Okay, thank you. Everybody understand the purpose of this and why we need to do it?
Yes.
I don't hear anybody saying that they need more discussion about that. So is there any comment, or if not, a motion to adopt that resolution?
I'll motion. This is Leslie.
Thank you, Leslie. Is there a second?
It's Chris Miller, second.
Thank you. Let's see. Can you call the roll, please, Mr. Ferris?
Yes, sir, Mr. Chairman. Chris Miller.
Yes.
Leslie Wilmer is a yes. Bruce Peters.
Yes.
Sheriff Youngblood has left. Kathy Prout.
Yes.
Thank you. John Surface. Dr. Lyon.
Yes.
Chairman Maggard.
Yes.
Orchel Cryer.
Yes.
And Dr. Canson.
Yes.
Motion passes.
Very good. Thank you. I just want to save you guys having to come together again on December 2nd, if we can avoid it. So yeah, thank you, Bruce. Okay. One more little comment from me. With the potential for a spike in February, and I see that February 10 is our next meeting, and it is scheduled to meet at Kern County Public Health. If that can that not change if necessary? And if so, can't we just make a similar finding? And GK, could you have that agendized just in the event that we have to do it remotely?
Yes, I will make sure to have that happen, Mr. Chairman, and you can make that finding and that resolution remotely and avoid an in-person meeting if the circumstances, and I believe they will still exist with respect to the health measures that require a remote meeting.
Okay, very good. Okay, colleagues, anybody else have anything to say for the good of the order today? Okay, then thank you very much. Our next meeting is February 10, 4 o'clock, and we'll let you know about the time or the place that will occur, or if it's remote. And the deadline for submitting requests to speak or documents to be reviewed there is Thursday, January 27, 2022 at 5 p.m. at the Kern County EMS Program Manager, Mr. Ferris. Okay, anything else? I would entertain then a motion to adjourn. Don't all jump up at once.
I'll motion.
Thank you very much. Happy holidays, everyone.
You too.
Okay, thanks. Bye-bye. Bruce, good luck to you, buddy.
Thank you, everybody.